Hello again, everyone. It's Adam Capek here again with the next in our series of talks of why are we all stuck indoors. For this one, I thought we could just answer the simple question of what is a doctor? Now, we've spoken about what the NHS is. We've spoken about a number of the different roles of people that work in the NHS. But clearly there are a lot of doctors that work in the NHS. I am one of them. And so I feel this is something that I'm able to talk about. It may, however, seem like the question, what is a doctor, should have a one word or at least a one sentence answer. You might simply say, well, it's someone that's been to medical school, they've become a doctor, there you go, now stop talking. But I do think it's a much more complex issue than that. I think there are many different issues to tease out here. And I'll try and just talk through some of those things. Some of you may well be interested in a career in medicine. Some of you may simply just be wondering, what is it that makes a doctor tick? Well, I'll try and come up with some answers to those questions. But as a first answer to my question of what is a doctor, I thought I'd ask my 5-year-old son. He drew me a picture. This is what he thinks a doctor looks like. I'm not entirely sure, but clearly it looks like a person, looks happy in their work, so that's good. I would say I absolutely love my job. If this is a representation of what I look like at my work, well, I am happy in my work. I think that's probably a stethoscope in his ears and round his neck. So anyway, this is what a 5-year-old thinks a doctor is. And maybe he's got as good an idea as I do. But let's try and tease that out a little bit more. Now, this is me at work. I've been lucky enough to travel with my work a fair bit. That's one of the huge joys of medicine. I think it's entirely transferable. This is me actually working in an operating theatre in Ghana. There I am. I'm looking a bit hairier. For what it's worth, I normally have a bit of a beard, but at the moment, because of the coronavirus crisis, we're all having to wear these tight face masks, and we've all been told we need to be fairly clean shaven. So that's where the beard's gone. And what am I up to here? Well, I am intubating a patient. So I'm putting a breathing tube through her nose using a flexible fiber optic camera. And what's on that screen there, that's me having a look at her vocal cords before I put that tube down. Now, why have I put this picture up there? Well, first of all, there's not actually very many pictures of me at work because we normally don't have permission to take pictures in the operating theatre, but in this situation we did. Secondly, it shows some of the technical parts of my job, some of the things about my specific role as an anaesthetist that I absolutely love. I love doing those technical skills, those technical procedures, and I love having to manage a team around me to help and assist me. So this is one of the Ghanaian assistants there who's helping me perform this procedure. I love the fact that this was a procedure that we were doing in someone that had critical medical problems, and in so doing and working with the surgeons and working with the nursing staff and working with all those other people, we were able to make a huge difference to this person's life. So I am in a role that every so often we come up against these challenges, these potentially life-threatening problems, and we're able to do very active, very obvious things that may fix those problems. You could even say occasionally we're in the position of saving someone's life. And to go home at the end of a day and know that that's what you've done is a phenomenal, phenomenal thing. I cannot think of anything in the world that would give me more job satisfaction. But if I'm honest, those events, those I saved someone's life today moments, they're fairly few and far between. They do happen, but they're fairly few and far between. Most of our work is about preventing harm. Most of the work of an anaesthetist is about keeping people safe while they're having an operation. Now let's go to what you might think is the other extreme of medicine. So this is a doctor's surgery. It happens to be the doctor's surgery that my father-in-law used to work in. This is a typical GP's, general practitioner's surgery. And you may think that it's a much slower pace of life. You may think, well, what life-saving goes on here? What I can tell you is a lot of the life-saving things that go on here, they might be less obvious, they might seem less dramatic, but they probably happen more frequently than I see them. Every time one of these doctors sees a patient, they have to make rapid decisions, rapid assessments as to what's going on here. Is it something that is potentially absolutely critical, that if I make a mistake here, I may affect this person's life? So for every 100 patients that comes to this doctor with a headache, how are they able to assess which ones are just simple headaches and which ones could show evidence of a brain tumor? So each role as a doctor is very different, but each one comes with its own challenges and its own critical steps in potentially saving people's lives, and certainly in changing the outlook of those people's lives. Now let's think about some other specialties. So here are some pathologists working in a lab, so they will have done the same medical training, same background medical training at medical school as the rest of us, and then they've divided off into a more lab-based specialty. So these pathologists, they're dissecting different tissues, perhaps samples that they've been sent from the operating theatres or from clinics, and they then need to identify by looking at these tissues what's going on here. Is there something serious? Is there a problem that needs to be treated? Again, it seems to be a different pace of life in the labs, but the decisions they make are just as critical to the patient care. And what about this chap? This chap's a radiologist, so he's a specialist in looking at x-rays. We've spoken about radiographers. They're the specialists in taking the x-ray pictures, while radiologists are the specialists in assessing them. What about his job? Again, it may seem that it's office-based. It may seem that it's just looking at pictures. They're now often on computer screens rather than these light boxes. But what if these people make a mistake? What if he misses this big ball in the bottom of this patient's lung? So this is a patient's lungs. This is the backbone going down the back. You see the collarbones there. You see the lungs are the big black air-filled spaces. That kind of golf ball shaped thing there, tennis ball shaped even, that's not normal. What if that radiologist misses that? This may well be a lung tumor. So different role, different dress code, different environment they work in, but the decisions are just as crucial. And we can take all manner of other jobs, doctors' jobs in the NHS. So this is a bacteria. The microbiologists at the moment are as busy as they've ever been because of the coronavirus outbreak. So these guys are specialists in looking at bugs, looking at infections, and working out how we can manage them. There are doctors who are involved in elderly care. So they're looking at older patients, taking a lot of the problems that may come with frailty and also other medical problems, so heart problems, breathing problems, brain problems that may well come with advanced age. And they're specialists in assessing those patients and trying to promote as independent a life as possible for their patients. This is a picture of the state hospital in Carstairs. So psychiatrists, they're specialists in dealing with thought problems essentially in the brain and psychiatric disease. And some of them will work in the forensic state hospital in Carstairs. So that's dealing with patients who may have committed very horrible crimes, but these particular patients have committed those crimes because of psychiatric problems. Could become a cardiologist again. Now that does seem obvious where the challenges come with that, looking after the heart, maybe unblocking. You see some of these arteries that are coming around supplying the heart muscle. These guys are specialists in unblocking those arteries, and when those arteries get blocked, that's the cause of a heart attack. What about here? This is a neonatal intensive care unit. So these guys are specialists in looking after the sickest of the sick newborn babies. And there's obviously intensive care units for adults as well, and they're experiencing significant challenges at the moment looking after people who are suffering with coronavirus. As I speak, our own Prime Minister is in one of these adult intensive care units, thankfully seemingly stable, but with coronavirus. And obviously surgeons, now they play a role. This is what the inside of someone's abdomen looks like if you're chopping out their gallbladder through keyhole surgery. You see these wee poles here which can cut and pull the gallbladder. That's the bottom of the liver that we're looking at now, and the gallbladder's up there. So they're all such different roles. We all start with the same medical degree, and we all then go through different specialist training, which can last anywhere between about 3 and 10 years to become a specialist in our own field. All of them absolutely vital towards the smooth running of the health service and promoting patient well-being. Have I really answered the question, though, of what is a doctor? I've spoken about specific doctors' roles, but I'm not sure I've really come up with that answer that unifies all of us. What is the point of a doctor? What is our reason for being, essentially? And I think rather than looking at the individual job titles, more useful than that is possibly just doing some reading. And there's various things that I have read in the last few years that I think are incredibly important to establishing what are we all about. Up here, this is the Good Medical Practice Guide Now, the General Medical Council, or the GMC, you'll hear them referred to, that's our governing body. So they essentially give me and my colleagues the right to practice as doctors in the country. And they have published guidelines as to what they'd expect from doctors that make up good practice. So things like honesty, integrity, openness. So that's clearly a good start for what are we as doctors expected to be achieving. But there's also some books which are written by doctors, which are not textbooks, but give huge thought and motivation to doctors in establishing what our role is. And the thing that I think binds these kinds of books, so this chap Atul Gawande, he's a surgeon in America. He's written several things. He's actually changed the way that procedures are done in operating theatres around the world in terms of checklists. So just like you might think a pilot has a checklist before they take off, checking that all the switches, all the dials are in the right place, we now use these checklists in the operating theatre. And this chap, Atul Gawande, he came up with that whole concept, which has been adopted in every operating theatre around the world. So that's him. This guy, Paul Kalanithi, he was a brain surgeon in the United States of America, and he's also written a significant book. Now, this book, Being Mortal, that's really looking at illness from a patient's perspective. What does it mean to be ill to that patient? Because if we as doctors can come up with some concept of what it's like from the patient's point of view, what are the things that are important to the patient, then we can look after them appropriately. And this chap, Paul Kalanithi, he tragically became very, very unwell while he was just about to finish as his training as a specialist brain surgeon. And he wrote a book that, again, looks at illness from the doctor's point of view and then from the patient's point of view, and tries to establish this guide for the way that we, all of us as doctors, should think about it. So what is our role? It's not necessarily chopping out a tumor. It's not necessarily unblocking an artery around the heart. It's not necessarily me putting everyone I see to sleep for an operation. It's trying to establish what is important to each individual patient, and in the context of their life and their family's life, working out what the priorities for their care are. Now, that's not always trying to treat a problem. That's not always trying to fix a cancer. Sometimes that's the wrong thing to do. Sometimes trying to go too gung-ho about things, trying to treat a problem, actually creates more problems, and it might worsen someone's life. So it's taking everything into the context of what's important to the patient first, and then giving some medical framework around it. And I think that's the thing that ultimately unifies all of these medical roles. There's many things we can do, but sometimes doing nothing is the right thing. But only with our medical training and with consultation with the patient and their family can we decide what the right course of action is. So if that's what a doctor's trying to achieve, what does a doctor look like? What is a doctor? Well, this was the first medically qualified woman in the UK. Her name was Elizabeth Garrett Anderson. She qualified in about 1865. So from that point in the Victorian times, where essentially every doctor was male, they looked like me, we now live in a medical world where more medical graduates from medical school are female than male. And nearly half of the fully qualified doctors in the country are also female now. So a fantastic state of affairs in terms of equity. Doctors are not male by any stretch of the imagination anymore. They are equally balanced between men and women. And I think medicine is a career that offers huge equality between the sexes. Do all doctors come from a background like this? Did they all grow up in a mansion house like this? Well, again, traditionally, it used to be a profession that people went into if they had a background of money behind them. But thankfully, huge efforts and huge work is going on, both in the health service and in the universities, to make sure that this isn't the case anymore. So in the last year at Glasgow Medical School, 20% of their medical school entrants came from the 20% most deprived regions of the country. So we're starting to balance the books on making sure that the doctors are much more representative of the population that they're looking after. Huge efforts going into this. I can't stress that enough. And there's huge support now in taking people from less advantaged backgrounds and promoting them into careers in medicine. And finally, do they all have the same skin color as me? Well, again, in this country, traditionally, maybe that would have been the case. But now we see the NHS, about 30% of the fully qualified doctors in the country are from Black and minority ethnic backgrounds. And to put that in context, only about 20% of the overall population are from BME backgrounds. So you may well see that medicine is actually a career that really is trying to promote well-being and welfare in those groups. So there is no unifying answer anymore to what a doctor is, what their role is, or what they look like. And maybe that does just bring us back to this picture by my son, the 5-year-old's drawing of what a doctor is. You could color that in with any clothing, with any facial color, with any kind of hair, with any gender. You could take that blank picture and now turn that into a doctor. We all ultimately operate with the same core beliefs and the vital principles of ensuring patient care at all times, and it's the care that's right for that individual patient, not just the care that a textbook might say we should offer. So I hope that's given a little bit of insight into what makes us tick as a doctor, why it's a career that excites me on a daily basis, that I find mentally stimulating, technically challenging, and quite honestly, you could not get me to do any other job in the world for all the money in the world. Thank you for listening, and I'll be back soon with another talk. Cheers.